Are you looking for information about Amitiza? Wondering what it is used for, how to dose it, and what potential side effects to be aware of? In this video, we will explore the common indications for Amitiza, provide dosing information, discuss potential side effects, and even include user testimonials. Amitiza is a prescription medication used to treat a variety of conditions such as chronic idiopathic constipation, CIC, and irritable bowel syndrome with constipation, IBS-C. It works by increasing fluid secretion in the intestines, making it easier to pass stools and relieving constipation. Common indications for Amitiza. Amitiza is primarily indicated for two conditions: chronic idiopathic constipation, CIC, and irritable bowel syndrome with constipation, IBS-C. Let's take a closer look at each of these indications. Chronic idiopathic constipation, CIC, refers to a condition where individuals have difficulty passing stools regularly. This can cause discomfort, bloating, and abdominal pain. Amitiza helps in increasing fluid secretion in the intestines, which softens the stools and makes them easier to pass. It is important to note that CIC is diagnosed after ruling out any underlying medical conditions that may be causing constipation. Irritable bowel syndrome with constipation, IBS-C, is a common gastrointestinal disorder characterized by abdominal pain, bloating, and infrequent bowel movements. Amitiza can be used to relieve the symptoms of IBS-C by enhancing intestinal fluid secretion and promoting regular bowel movements. It is important to consult with a healthcare professional for an accurate diagnosis and to determine if Amitiza is the right treatment option for you. Understanding dosing information for Amitiza. When it comes to dosing Amitiza, it is important to follow your healthcare provider's instructions. The dosage may vary depending on the condition being treated and your individual response to the medication. For chronic idiopathic constipation, CIC, the typical recommended starting dose is 24 mcg twice daily with food and water. However, your healthcare provider may adjust the dosage based on your response to the medication. It is important to take Amitiza as prescribed and not exceed the recommended dose. For irritable bowel syndrome with constipation, IBS-C, the recommended starting dose is 8 mcg twice daily with food and water. Again, your healthcare provider may adjust the dosage if needed. It is essential to communicate any changes in symptoms or concerns with your healthcare provider to ensure the most effective dosing regimen. Potential side effects of Amitiza. As with any medication, there are potential side effects to be aware of when taking Amitiza. It is important to note that not everyone will experience these side effects, and some individuals may have a different experience. However, it is essential to be informed about the possible side effects. Common side effects of Amitiza include nausea, diarrhea, and abdominal pain. These side effects are generally mild to moderate in severity and may lessen with continued use. If these side effects persist or become bothersome, it is important to consult with your healthcare provider for guidance. Less common side effects that have been reported with Amitiza include headache, vomiting, flatulence, and dizziness. If you experience any severe or persistent side effects, it is crucial to seek medical attention immediately. User testimonials on the effectiveness of Amitiza. To provide a well-rounded perspective, let's take a look at some user testimonials regarding the effectiveness of Amitiza. Please note that these testimonials are individual experiences and may not reflect the results you may achieve. I have been suffering from chronic constipation for years, and Amitiza has been a game changer for me. It has made passing stools so much easier and more comfortable. I no longer have to rely on laxatives, and my overall digestive health has improved significantly. As someone with irritable bowel syndrome, I have struggled with constipation for a long time. Amitiza has been a lifesaver. It has helped regulate my bowel movements and reduce the bloating and discomfort associated with IBS-C. I highly recommend it to anyone dealing with similar issues. I was initially skeptical about trying Amitiza, but it has exceeded my expectations. Not only has it relieved my constipation, but it has also improved my quality of life. I no longer feel anxious or worried about having a bowel movement. I am grateful for this medication. These testimonials highlight the positive experiences some individuals have had with Amitiza. However, it is important to remember that everyone's experience may differ, and it is essential to consult with a healthcare professional to determine if Amitiza is the right treatment option for you. Important considerations and precautions when taking Amitiza. Before starting Amitiza, there are a few important considerations and precautions to keep in mind. It is crucial to discuss your medical history and any current medications or supplements with your healthcare provider to ensure Amitiza is safe for you to take. Amitiza should not be used if you have a known allergy to lubiprostone or any of the other ingredients in the medication. It is important to inform your healthcare provider of any allergies you may have. It is also important to note that Amitiza is not recommended for use during pregnancy or while breastfeeding. If you are pregnant, planning to become pregnant, or breastfeeding, it is crucial to discuss alternative treatment options with your healthcare provider. Additionally, it is important to be aware that Amitiza may interact with certain medications, including certain antibiotics and antifungal medications. It is important to inform your healthcare provider of all medications, supplements, and herbal products you are currently taking to avoid any potential interactions. Alternative treatments to Amitiza. While Amitiza may be effective for many individuals, it may not be suitable for everyone. There are alternative treatments available that may be worth exploring. Some alternative treatment options for chronic idiopathic constipation, CIC, and irritable bowel syndrome with constipation, IBS-C, include dietary changes. Increasing fiber intake, staying hydrated, and avoiding trigger foods may help alleviate symptoms of constipation. Over-the-counter laxatives. These medications can provide temporary relief for constipation. However, long-term use may not be recommended. Probiotics. Certain strains of probiotics have shown promise in improving gastrointestinal health and promoting regular bowel movements. Behavioral changes. Stress management techniques, regular exercise, and establishing a consistent bowel routine may help manage symptoms of constipation. It is important to consult with a healthcare professional to determine the most appropriate treatment option based on your specific needs and medical history. Frequently asked questions about Amitiza. Is Amitiza addictive? No, Amitiza is not considered addictive. It works by increasing fluid secretion in the intestines to relieve constipation. Can Amitiza be used for children? Amitiza is not approved for use in children. It is important to consult with a healthcare professional for appropriate treatment options for pediatric constipation. How long does it take for Amitiza to work? The onset of action can vary from person to person. Some individuals may experience relief within a few days, while others may require more time. It is important to follow the prescribed dosing regimen and consult with your healthcare provider if you have concerns. Can I take Amitiza with other medications? Amitiza may interact with certain medications, so it is important to inform your healthcare provider of all medications, supplements, and herbal products you are currently taking to avoid any potential interactions. Consulting with a healthcare professional about Amitiza. It is crucial to consult with a healthcare professional before starting Amitiza or any other medication. Your healthcare provider will evaluate your symptoms, medical history, and any potential contraindications to determine if Amitiza is the right treatment option for you. During your consultation, be sure to discuss any concerns, questions, or alternative treatment options you may have. Your healthcare provider is the best resource for personalized advice and guidance. Conclusion. Amitiza is a prescription medication used to treat chronic idiopathic constipation, CIC, and irritable bowel syndrome with constipation, IBS-C. It works by increasing fluid secretion in the intestines, making it easier to pass stools and relieving constipation. When taking Amitiza, it is important to follow your healthcare provider's instructions regarding dosing. Common side effects of Amitiza include nausea, diarrhea, and abdominal pain, but not everyone will experience these side effects. User testimonials have demonstrated the positive impact Amitiza has had on individuals struggling with constipation. However, it is important to consult with a healthcare professional to determine if Amitiza is the right treatment option for you. Remember to consider alternative treatments, discuss any concerns with your healthcare provider, and follow their guidance throughout your treatment journey. With the right approach and support, Amitiza may help you manage your symptoms effectively and improve your overall quality of life.